Sudden dizziness can feel terrifying, especially when it strikes you without warning and steals your sense of control. For many of you after 60, it brings a quiet, constant fear. You wonder if this is the moment you might fall, faint, or embarrass yourself in front of others. Even simple movements like sitting up, turning your head, or looking over your shoulder can suddenly feel unsafe, as your brain struggles to interpret confusing signals coming from the neck and balance system. Now hear me out. Research published in the Journal of Geriatric Physical Therapy found that the risk of persistent dizziness and balance-related falls is nearly 40% higher when neck mobility is reduced, even if inner ear tests appear normal, because disrupted nerve signaling and altered blood flow between the neck and brain interfere with the body's balance system, and this can be reversed. So there is hope. In this episode, Japan's oldest doctor will guide you through a proven exercise sequence built on 2 neck stretches every senior must do to reverse dizziness instantly, reduce neck tension, support nerve communication, followed by 3 simple neck exercises that help the neck and brain work together again. And please stay with us this whole episode, since you will only see effects following the entire sequence. Welcome back to the Senior Health Podcast, where East meets West to help you stay steady, clear, and independent. Today, we explore why neck-related nerve compression becomes more common after 60, how it quietly fuels dizziness and fear of falling, and most importantly, the specific short exercises that begin addressing it without strain. And to guide us through this is Japan's oldest physician. Doctor, please tell us why this episode matters so much.
Thank you, John. This conversation is important because the neck plays a central role in how the brain understands position and movement. When stiffness and compression build over time, the brain begins to doubt its sense of balance. This change often happens gradually and is dismissed as aging until one sudden dizzy moment reshapes how a senior moves through the day. But I promise that we can reverse this process instantly by today's exercises.
That is exactly what I hear from seniors in my own practice. So before we begin, please comment a 1 if turning your head has ever made you feel dizzy, or a 2 if your neck feels stiffer than it should.
Actually, you are far from alone. A longitudinal study published by the Department of Orthopedic Surgery at Kyoto University found that nearly 1 in 3 seniors over the age of 60 is experiencing dizziness specifically triggered by neck movement or stiffness, even without inner ear disease. So if you are noticing this in your own body, it does not mean something is failing. It means your nervous system is responding to changes that are very common with aging.
So doctor, before we dive into today's sequence, please briefly explain to us what is really happening in the neck that makes dizziness appear so suddenly after 60, even when scans look normal.
Well, when scans look normal, it often means the problem is not damage, but communication. The neck contains dense sensors that tell the brain where the head is in space, and with age those signals can become noisy. When that happens, the brain feels uncertain and dizziness can appear suddenly.
That really lands because seniors are told everything is fine and yet their body feels off. I hear that frustration a lot, especially when symptoms are brushed off as stress or age.
Yes, and this condition is often called cervicogenic dizziness, though the name matters less than understanding it. Tight joints, inflamed muscles, and reduced movement change the messages traveling from the neck to the balance centers. The inner ear may be working, but the brain is receiving mixed instructions.
That explains why turning the head can suddenly feel unsettling, right?
Exactly, and this pattern has been carefully studied in Japan. A clinical follow-up published by the Department of Rehabilitation, Medicine at Tokyo Medical and Dental University tracked over 400 seniors aged 60 to 80 for 3 years and found that those with reduced cervical range of motion were more than twice as likely to report recurrent dizziness and balance instability, even when inner ear testing was normal. Less movement led to more stiffness and that stiffness quietly trained the nervous system to expect imbalance.
That cycle sounds exhausting and emotionally draining for me.
It is, and the key here is that this process is usually reversible. When we restore gentle motion and reduce guarding, the brain regains trust. And that trust begins in two very specific muscles most seniors overlook. So let's dive in, shall we?
All right, I am leaning in because that feels hopeful and very practical. So which muscles are you referring to, and how do they connect to dizziness?
All right, let me explain clearly, and I want everyone to picture this with me. We begin with the upper trapezius, the broad muscle from the shoulder to the neck, because it tightens from posture and years of guarding. You gently sit tall, pull your shoulders back, place one hand over the opposite side of your head, and slowly guide the air down and slightly forward until you feel a stretch along the side of the neck.
I can already imagine seniors realizing how tight that area feels. It sounds simple, but very intentional.
Yes, and we hold that stretch calmly for about 30 seconds, breathing normally, then repeat on the other side. And we do this 3 times on each side. The key is never forcing the neck and letting the shoulder drop naturally instead of lifting it. This stretch alone often brings warmth and a sense of release that tells the brain it is safe to relax.
I think that safety piece feels especially important for seniors dealing with dizziness.
Now let's move to the sternocleidomastoid, which runs from behind the ear down toward the collarbone. You gently turn your head to one side, then slightly lift the chin until you feel the stretch along the front of the neck. If needed, you subtly adjust the angle up or down until you find the spot that feels the most tight, and you hold there without strain for about 30 seconds.
That level of guidance will really help seniors feel confident doing this correctly. And I think we do both sides again, right?
We do. And I want to emphasize something important here. If you feel pain in the back of the neck or joints, not a stretch in the muscle, you should stop and soften the movement. These stretches are meant to feel steady and controlled, never sharp or rushed.
That reassurance alone removes a lot of fear for seniors at home.
And once these two muscles begin to loosen, something interesting happens. The neck starts moving more freely, but the brain may still feel unsettled because deeper tissues are holding tension. That is where the next step of this sequence changes everything.
That really catches my attention, and I feel that the next part is very important. Tell us, what are those deeper areas, and how do we work with them safely without triggering more dizziness?
Well, let me explain, and I want to be very clear that here we are releasing muscles now, not stretching them.
Right. Releasing and not stretching.
Now, just beneath the base of the skull sit the suboccipital muscles, and they are small but extremely influential. When they stay clenched, they constantly send distorted balance signals to the brain.
That clarity matters, because seniors often think tighter pressure means better results. This sounds more intentional and controlled. So how do we release them?
Exactly, and the goal is release, not force. Seniors place 2 fingers just under the back of the skull, slightly off to one side, and apply gentle, steady pressure into the muscle. While holding that pressure, they slowly rotate the head side to side, allowing the muscle to soften under the fingers.
That feels more like melting tension than pushing through it. How many times do we do this?
We do this for 5 times at each side, John, and tenderness is here normal, but pain is not. If dizziness increases, seniors simply reduce the range or pressure. The nervous system responds best when it feels safe, not challenged.
That distinction alone will help many seniors relax into the movement.
Correct. Now let's move to the scalenes, which we also will release and not stretch. For this, seniors gently tilt the ear toward the shoulder, then place 2 or 3 fingers just below the bump of the ear and slowly glide downward along the muscle. The fingers gently draw the tissue down as the head tilts, allowing the muscle to let go layer by layer.
That explains why posture and breathing matter so much here.
Yes, and when both the suboccipitals and scalenes release, many seniors feel a surprising sense of openness. The neck moves more freely, but it can briefly feel unsupported. That sensation tells us the tension has been released, but strength has not yet been restored. And to fix that, we have a very easy exercise.
That feels like a pivotal moment in the process. What exercise do you have in mind to help the neck feel stable and secure again after releasing those muscles?
Well, let me explain. Once those surface and deep muscles release, the neck needs gentle guidance, not more looseness. That stability comes from the deep cervical flexors, which are small muscles that sit close to the spine and act like quiet anchors for the head. When they are active, the brain feels supported and dizziness begins to settle.
That feels reassuring, because seniors often worry they have gone too far once things feel loose. It helps to know stability can be rebuilt calmly.
It is, and we do this with a simple exercise everyone can do seated. First, you take a folded pillowcase or a light band behind the head and bend the elbows at 90 degrees.
All right, this looks doable for anyone.
It is. Now we gently pull forward to create light resistance. From there, you tuck the chin slightly, then slowly draw the head straight back, as if lengthening the neck upward, and hold for about 5 seconds before relaxing.
That visual really helps, especially the idea of length rather than force.
Yes, and the key here is what it should feel like. Seniors should feel effort deep in the front of the neck and a mild stretch under the skull, not strain in the jaw or shoulders. If the face tightens or the shoulders lift, the movement is too strong and should be softened.
That guidance will help seniors avoid common mistakes and feel more confident.
When done correctly, this exercise teaches the neck how to support itself again. It prepares the muscles for movement without triggering fear.
I can sense that this sets the stage for building strength next. How do we safely add strength without bringing dizziness back?
Yes, we end the sequence with that, so everyone stay with me because this part is extra important to get long-lasting effects. We add strength by asking the muscles to work without moving the neck, which keeps the nervous system calm. This is called isometric strength, and it lets you build support right at the edges of your comfort. When done slowly, it tells your brain that movement is controlled and safe.
I imagine seniors feel more in control right away.
Yes, and we begin with rotation. Seniors gently turn the head to one side until they reach a comfortable end point. Then place a hand against the forehead or side of the head and press lightly without allowing movement. They hold that effort for about 5 seconds, then relax and return to center.
I like that it emphasizes effort without motion.
Of course, and we repeat that on the other side, usually 3 sets of 8 to 10 gentle holds. The pressure should be steady and calm, never forceful. Mild dizziness can happen at first, but it should fade quickly once the head returns to neutral.
That distinction between mild and lingering dizziness feels very important.
Now we move to lateral flexion, which is ear toward shoulder. Seniors tilt gently to the side, place the hand above the ear, and press just enough to activate the muscle without changing position. Again, 5-second holds, slow breathing, and equal attention to both sides.
I hear how balance and patience are built right into the exercise. So here we push with our hand and head in opposite directions?
Yes, exactly like that. Now the final part is protraction and retraction. For this, seniors gently bring the head forward, Place the palm against the forehead and press while keeping the head still. Then they reverse it by drawing the head back slightly and pressing into their hands behind the head, always while keeping the shoulders relaxed.
That sounds very grounding, almost like teaching the neck where center is again. And again we push with our hand and head in opposite direction, right?
Exactly. And these movements rebuild strength where seniors often feel most vulnerable. If dizziness increases beyond mild or lasts more than a few moments, that is the signal to reduce effort or stop for the day. Progress comes from consistency, not intensity.
That message alone will help seniors avoid pushing too hard.
John, let me tell you something. When these strength exercises are practiced daily, something important happens. The neck begins to trust its own support, and the brain stops anticipating imbalance. Confidence returns quietly, often before seniors even notice it.
That feels like such a hopeful shift. So how long does it usually take before seniors begin to feel that confidence settle into their daily movements?
I want everyone listening to remember this. These changes do not arrive overnight, but they do arrive with steady care. When you move a little every day, the body listens and responds, I promise you.
That patience is hard, but it feels reassuring to hear that progress can be quiet and still meaningful. It gives seniors permission to stay with the process without rushing it.
And if symptoms do not improve, or if dizziness worsens instead of easing, that is the moment to seek professional guidance. This routine supports the body, but it does not replace proper evaluation when something feels wrong. The goal is always safety, confidence, and helping seniors move through life without fear.
Thank you, doctor. Let's end it here. If you are still listening and you found this helpful, please hit that like button and subscribe to the channel. Oh, and watch this next video right now.
Yes, please.
We've picked this one especially for you.